Veterans, this is serious. The VA has lost thousands of doctors, nurses, and other medical professional staff. Wait times are climbing, care is being delayed, and patient safety is at risk. Let's break this down in this video, why this may affect you. Hey, this is Russ from Veteran Experience. If you like this kind of content, please like, subscribe, send it out to other veterans who may need it. This is how we get our content out to help other veterans like you understand what would impact them in the VA and how to get their claims approved. Let's talk about it. The alarming trend is that wait times are growing. If you haven't noticed longer wait times, canceled appointments, or overworked staff at your VA hospital, it is here with us. You're not imagining it. The Department of Veteran Affairs is in the middle of a massive staffing crisis. Since the start of this fiscal year alone, the VA has lost thousands of professionals, 2,000 registered nurses, 1,300 medical assistants, 1,100 nursing assistants, and licensed practical nurses, 800 doctors, 500 social workers, 150 psychologists. These aren't just numbers. These are medical professionals that provide care for you and for me. It's the core of the medical staff. The people in the VA, the losses are growing, the systems are being stretched, and patient safety is at risk. How did we get here? The VA monthly workforce dashboard shows something troubling is going on. Every single month since the president has taken office, staffing levels have dropped. Secretary Doug Collins says that these cuts of 30,000 are jobs that won't affect anything. They're redundancies. They're just extra people. They're people that's on lunch all day. We know that it's not the case. These are real people with real jobs that provide real service to veterans like you. Deferred resignations, offering our medical people and the staff in the VA an early retirement out of the VA has also added huge losses to the VA workforce. Chaos in the VA, the stress that medical professionals are feeling because of the president's initiative has allowed many doctors to say, you know, I came here to help people. I didn't come here to not know what tomorrow is going to bring. I didn't come here to be stressed out in my day-to-day work. And they go off to a civilian hospital with more compensation and better work environment. So I want to talk to you just briefly why this will hurt you, the veteran. The time couldn't be worse. In 2022, Congress passed a bipartisan deal that expanded the VA eligibility for veterans exposed to toxic burn pit and other wartime chemicals. This needed to happen. That means hundreds of thousands of new patients. It is estimated that over 400,000 new veterans have come into the VA since 2022. You couple that with the loss of medical care professional, and this is a disaster that is brewing. You don't have to believe me, just believe the Inspector General. He reported that 86% of VA medical centers had severe doctor shortage. 86%. 82% has severe nurse shortage. Now add another 2% decreases in nurse and 3% decreases in doctors coming in for this year, and this grows substantially. When you have fewer providers but more patients, something has to break. Unfortunately, it's often wait times and the level of care that is provided to patients like you and me. What are veterans and staff seeing? This is really a critical point. In Augusta, Georgia, a nurse in the spinal care injury unit says that the situation is very unsafe. Her patients includes veterans who have been paralyzed, in most of them in Iraq and Afghanistan. And they have to do what they should not have to do, and it's jeopardizing or it's putting at risk the safety of these paralyzed patients. Because of the shortage of medical professionals, untrained nurses in other departments are being pulled into this critical care unit for spinal cord injury veteran center. And they don't know all of what they should know because it's not their specialty. And that is leaving many patients at risk. And she goes on to say that 2 nurses caring for 10 patients, 7 on ventilators, 3 nurses caring for 9 patients, all in isolation, staff regularly forced to do overtime until burnout, Many of them have to work through their luncheon breaks. In Brooklyn, on VA, the ICU nurse says that 3 patients per nurse each, which is beyond what the standard should be. It should only be 2 per nurse. 10 patients were in isolation and critical equipment was broken. These aren't isolated stories. This is the reality that many VA employees and patients are experiencing under this administration. There's rumors about privatization of the VA. Critics say that these cuts aren't just about budgets. They are part to push the VA into the privatization of the VA. And here's what will happen. Cut staff in public VA hospitals, make it harder to get care there, and redirect veterans into a private health care through voucher programs, which will be devastating to the health of you as the veteran. $1 billion increase in taxpayer funding for private health care. It sounds good, but if they cut the VA and push everybody into private care, a private care doctor doesn't have the same commitment to you as a veteran. He's there as a for-profit entity. He's not going to give you the test that you need. He's not going to go the extra mile to find a solution to your combat injuries. Listen, this is just how it is in the civilian medical world. This all means for you and I, longer wait times and less than quality service. If you experience that, drop it in the comments and so we can get a feel of how many people that are experiencing these conditions. Where I am here in my regional area, so far the VA medical service has still been excellent. So I have no complaints, but I've heard other veterans in other regions that are experiencing much less quality of care than I am in my region. So here's what you can do. As a veteran, I would say document your care. This is not to isolate or to highlight one particular individual, but the care in general. And you need to call your congressman and your senator and start telling them, this is what I'm experiencing. This is unacceptable. The experience that we are receiving based on the service that you have given this country. If you don't speak up, the service will only get worse until people start to die. And we experienced this here in Phoenix some years ago, where you had veterans die waiting for care. We don't want to go back to that. So if you are experiencing this, call your political representatives and let them know. Hey, this is Russ from Veteran Experience. If you like this content, please like, subscribe, send it out to other veterans so they can understand what the circumstances is concerning the VA and the care that they should receive there. Until next time, do what we always say, keep fighting.